talk tonight?
Hello everyone. So I was originally asked to do a presentation on mare subfertility and thinking about that topic just made me realise what a massive topic that really was, and how really this talk needed. I decided to go with something that's super common, endometritis, and something that I think anybody that works on horse farms or with brood mares will be very familiar with. It's a massive topic in itself, so we're just going to do a bit of a whistle-stop tour and go through the sort of causes, how you identify it, and just a couple of the potential treatment options. So what is endometritis? The definition really is inflammation or infection of the inner lining of the uterus, and really it's probably the dominant cause of subfertility. Certainly represents anything up to 60% of the diagnosis in barren mares, and many studies will show far greater percentages in terms of the underlying cause. It's important to differentiate from metritis. So metritis is a condition that we often see associated with retained fetal membranes. Endometritis doesn't have any external clinical signs of disease, so when you look at the mare, there's nothing untoward in physical examinations that you could detect, whereas metritis does cause ill health and is of a serious sort of overall medical concern. So how does endometritis start? And there's lots of different potential mechanisms, but really we need to consider it as a normal response to breeding. So this diagram shows how breeding itself can stimulate an inflammatory response in all mares, but obviously in the majority of mares, this inflammatory response is cleared successfully and the inflammation subsides. In mares that are either susceptible to endometritis or have pre-existing or compounding factors exacerbating the condition, there's an inability or failure to clear inflammatory products, and then continued and increased inflammation, which can lead to persistent endometritis. And secondary infections can then result. You can get altered immune responses, and if the uterus remains inflamed for some time, we can get degeneration, which is obviously a concern for future breeding. So other mechanisms, and really we're talking about non-infectious endometritis, which means not caused by either bacteria or fungi or yeast, and infectious endometritis, whereby we have a pre-existing infection with usually bacteria in probably 60% of cases, and less commonly fungal in around sort of maybe 1 to 2% of barren mares. With regards to the non-infectious, we've got urine, post-mating, as we've already discussed, and air. And the presence of anything in the uterus really can stimulate inflammation. And so external anatomical abnormalities are key to reducing the risk of endometritis developing. And when we talk about external anatomical abnormalities, we're talking about mares with a very sloping vagina, either a poor vulval seal or a propensity to pool urine. Provides the barrier from the vagina and vestibule to the uterus. And so if we've got abnormal cervical function, we can get reduced uterine clearance, which means that potentially fluid can't evacuate the uterus, which means it can become colonized by bacteria, or direct sort of primary cervical problems where we have tears, again breaching the barrier from the vulva, vagina to the uterus, but sometimes also cervical abscesses, which can directly seed the uterus and set up endometritis. So other risk factors, poor uterine clearance, and often in older mares that have had lots of foals, the uterus can sit very low down in the abdomen, which means that gravity is not on our side in terms of fluid being able to evacuate. But mares that have foaling complications, dystocias, are much more prone to having this condition when they come around to be bred thereafter. And you can see this mare has a lot of vaginal hematoma, swelling is a risk factor for endometritis. If we have retained fetal membranes, inevitably there'll be inflammation that sets up in the uterus. And if this isn't managed swiftly, that can then progress to secondary infections and more chronic changes. Multiple breedings at mating has increased risk for endometritis. Obviously, most mares will clear that normal post-breeding inflammation quite swiftly within about 72 hours. But in a subset of mares that are at risk of this condition, multiple breedings on the same heat is associated with more persistent inflammation, which isn't always readily cleared. And if it's not treated, can progress to subfertility and reduce pregnancy rates. Breeding hygiene is important for reducing the likelihood of this condition developing, and that doesn't just mean in the covering shed, but also any time that we're entering the vagina to do treatments, uterine swabs, even repairing caslets, we need to consider cleanliness, the need for tail bandages and cleaning as utmost priority. So why is it actually a problem to have an inflamed uterine lining? Obviously, if you've got inflammation, you're not normal, and we want this environment to be as normal as possible for it to, host a pregnancy. But there's a little bit more to it than that. The presence of inflammation itself will result in fluid and inflammatory products, which create a hostile environment for any newly fertilized embryo. So a newly fertilized egg will arrive to the uterus around about day 6. And if the uterus isn't in good shape when that happens, then we're not going to provide the optimal conditions for its survival. If the uterine wall is inflamed, we might not get recognition of that early pregnancy, but also we can have the production of uterine prostaglandins, so PG, that we use to bring our mares back into season. The uterus itself, when it's inflamed, will produce this hormone, which can lead to early breakdown of the CL, short cycling, and potentially pregnancy loss. So how can we detect endometritis? And fortunately, in most cases, it's readily detectable on reproductive ultrasound examinations, combined also with routine swabbing techniques. So generally speaking, we're talking about mares that have fluid and or uterine wall changes or excessive edema patterns. And that can be both when they're in season or in the interovulatory period. Sometimes mares will have very pronounced fluid production post-mating, but other times this can be much more subtle. And in some cases of endometritis, there won't be anything untoward to see at all. So we're combining our routine ultrasound examinations with swabbing techniques. And swabbing is done for the purposes of cytology, the microscopic study of cells, but also for the purposes of culturing, which we'll come on to. So cytology is collecting cells from the lining of the uterus and then examining them under a microscope to look for characteristic changes that we associate with inflammation. So on the left, you've got normal epithelial cells, so normal surface lining cells of the uterus, and these are all sort of stacked together, and we can't see any inflammatory cells. And then on the right, you've got cells called neutrophils, which are involved in the sort of management of infections and inflammation in the body. And if there's inflammation in the uterus, these cells will migrate to that site and be detectable usually on your sample. And those can be detected using swabs or cytology brushes, but also collection of low volume lavage fluids, which are then sort of spun down and examined in the same way, or much more comprehensively by uterine biopsy. And lastly, bacterial culture. So again, we're sort of obtaining bacterial cultures on our routine swabbing techniques. And these will be processed both for general screening on blood agar is pretty typical. So this is E. coli growing which is one of the commonly isolated bugs in the mare uterus. And the bottom right, this is chromogenic agar, which is a special type of agar which has colour changes which differentiate different bacterial types. But often it's a bit of a minefield, and we suspect endometritis is there, but we can't actually find it. So we might not be able to culture bugs, and we might not have inflammatory cells on our swabs. And that probably accounts for a minority of cases, but there'll certainly be barren mares where we've got pretty little to go on. And in terms of looking for a gold standard diagnosis, then probably biopsy is the way forward. So that's actually taking a tissue sample from the surface of the uterus, sending it away for histology and in-depth microscopic analysis. So that will give us an idea of the cell types present, but also whether or not there are any latent bacteria in the different layers of the uterus. And we can also grade these biopsies to give us a prognosis for breeding based on certain characteristics like the degree of uterine fibrosis, for example. So how do we treat endometritis? And it's a very multi-layered approach, which has to be tailored to each individual mare. And it's really kind of beyond the scope of this lecture. So I'm just going to pick a couple, and hopefully that will shed some light at least on part of the approach. So treating infections. Infections probably account for at least 60% of the cases of endometritis. So that means that, you know, in barren mares that are presented, probably over half of them have an infection. Whether or not it can be cultured or not, whether or not it's identified on biopsy will depend. So a bacterial component is likely, but really we need to be quite mindful about our strategy, therefore, as to how to treat them. We need to know which bug, if possible, and therefore try and treat them specifically with antibiotics that we know will be effective. And this is important ever increasingly, especially with growing concerns about antibiotic resistance. So in 2020, the World Health Organization declared an emergency state and stated antibacterial resistance was one of the predominant threats to global health and food production, but also just development in general. And so whilst we've got to accept that probably bacteria account for a lot of our problems in mares, we need to be quite clever about how we use antibiotics and take into consideration the different bacterial traits in our treatment strategies. And that sort of brings me on to the next aspect, which is managing biofilm. So biofilm is a sort of relatively new concept. It's described as an accumulation of bacteria and bacteria-derived substances protected within a sticky organic matrix that can adhere to surfaces. So it's not something we can see, but effectively it's a product of some bacterial populations. And the main issue with it is that it can be incredibly long-lasting, but it also protects the bacteria somewhat, both from the body's own immune system, but also from medications such as antibiotics that we use to get rid of bacteria. And bacteria can be up to 10 to 1,000 times more resistant to antibiotics when they're within a biofilm itself. They're also protected, as I said, from the host immune system, which means that the mare's normal ability to fight infection is reduced. And it can also make it harder to actually physically grow bacteria. So we might assume that they're not there based on the back of negative multiple cultures, but also because they're not stimulating an inflammatory response, we might not pick up any changes on our cytology. So how can we manage this problem? And really there are two aspects. The first is actually physically disrupting the biofilm and breaking it down. And then the second aspect is to kill the bacteria. And some of the agents we use against biofilm will achieve both these things simultaneously, but some don't. And that's where identifying specific bacteria is important, because different bacteria respond differently to each of these agents. So getting a diagnosis rather than treating blind is always the best way forward, but obviously we've got to be mindful that that's not always practically possible. So some of the known biofilm producing bacteria include E. coli, which is one of the predominant cultures that we'll find in endometritis. And if you look at different studies, you'll get different prevalence rates of that bug in terms of actually causing endometritis. But broadly speaking, we could say that maybe up to 25% of all cultures might be E. coli. And so if you consider that perhaps up to 25% of endometritis cases could be biofilm producing bacteria, or more if you consider that there are others, for example, strep, then we need to think about this as something we should be really doing as part of our clinical practice in treating endometritis, one of the most common causes of subfertility. One of the other great things about a lot of these agents is that they can actually reduce antibiotics. And if when we're treating bacteria, we're treating them more effectively, we therefore can use less. And in consideration of what we mentioned earlier about prevalence of bacterial resistance, this can only be a good thing. And the last aspect I'm going to talk about is removing inflammatory products. So removing inflammatory products and dealing with fluid has got to be probably top one or two emerging endometritis as a condition. And generally this is achieved with uterine lavage, so that's physically flushing the mare. So we generally will use 1 or sometimes 2 litres of sterile fluid infused through the cervix into the uterus, and then directly siphoned back out. And this is done to remove physical debris, but also to dilute out bacteria. And this process can be repeated over and over until we're sort of satisfied that the level of contamination is reduced. And this is combined with drugs to promote uterine clearance, so oxytocin, sometimes dilating the cervix just to actually make the passage, and kind of forgotten is exercise. Promote natural uterine clearance. And uterine lavage can be done as part of your general treatment approach. So, for example, if you're treating biofilm, I would often then flush them afterwards, because I think often if you're using a product to destabilize biofilm, you'll get a lot of debris coming away. So I'll use it as part of that treatment, but also pre and post covering, just to provide an optimum environment for the sperm, but also to remove those contaminants after breeding. So as a summary, endometritis is a naturally occurring response in all mares to breeding, but in normal mares, this will usually be cleared naturally by about 72 hours. But persistent endometritis is the most common cause of infertility. And the diagnosis in most cases will be on ultrasound and swab. And I've put most because I think we'll all be familiar with cases that really have no indicator of any underlying issue. And we will use common treatments for endometritis and have breeding success. Perineal confirmation is probably the greatest risk factor. So cas-licking mares and reducing any risk of contamination into the vestibule is probably the best way to prevent this from happening. And if it does occur, we have to be prepared for multi-layered treatments targeted to each individual